Are you familiar with oral head and neck cancers? I'm Catherine. Welcome to the Inspired Vitality Show. Today I'm talking about oral head and neck cancers in support of their Awareness Week and as part of my ongoing series spotlighting the different cancers. Because there are many cancers collectively known as oral head and neck cancers, I'm going to give a very brief overview, but then I have some great resources that I'm going to share with you if you want to go deeper. First, tell me quickly, have you or anybody you know been impacted by a cancer under the umbrella of oral head and neck cancers? These are more rare, so leave me a comment if you or a loved one has been impacted. I'd love to hear from you. The goal of Oral Head and Neck Cancer Awareness Week is to encourage adults who are at high risk for these cancers to get screened. A key message is that early diagnosis is key to successful treatment of these types of cancers. Now, some facts about the oral head and neck cancers. They account for about 4 to 6% of all cancers in the United States. Men are 2 to 3 times more likely than women to develop head and neck cancer. However, the rate of the head and neck cancer in women has been rising over several decades. People over the age of 40 are at higher risk for these cancers. Alcohol and tobacco use are the 2 most important risk factors for head and neck cancers and do account for at least 75% of the head and neck cancers. Infection with cancer-causing types of HPV is a risk factor for some types of the head and neck cancers. When detected at stages 1 and 2, the survival rate is over 80%. However, more than half of all cases are found later. At more advanced stages, survival rates are lower, treatments are more invasive, and the side effects of treatment are much more significant. Because of the location of the head and neck cancers, it often affects breathing, eating, drinking, your voice, ability to speak, and appearance. Cancers of the head and neck include cancers that start in several places in the head and the throat, not including brain cancers or cancers of the eye. They are further categorized by the area of the head or neck in which they begin. Some of the places that these cancers can start are in the sinuses, inside and behind the nose, in the mouth, including the tongue and the gums and the roof of the mouth, in the back of the mouth and the throat, in the larynx or the voice box. Some of the signs and symptoms are a lump or sore in the mouth or throat, hoarseness or change in voice, swallowing problems or pain, bleeding in the nose, mouth, or throat. Most often, however, head and neck cancers are discovered only after a patient has sought treatment for symptoms that have become problematic. So what can you do? Well, many of us have heard of self-breast exams. And like the breast self-exams, a head and neck cancer self-exam is an opportunity for you to get to know your body and what's normal for you. You should look for abnormal or irregular or discolored areas. Repeating this exam monthly can help you identify changes that should be examined by a doctor or dentist. If there is a concern, often there is a process of doctor visits and tests prior to a diagnosis and meeting an oncologist. This is a time of stress and overwhelm of information, so it helps to be prepared and take notes at appointments. I found a great list of questions to ask an oncologist to help you better understand your diagnosis, treatment plan, and overall care on cancer.net, and I'm going to link to it in the video description. 2 other resources that I have for you are a fact sheet about oral head and neck cancers and a video, both by National Cancer Institute, and I'll put links to these as well in the video description. I hope this overview of the resources for the oral head and neck cancers have been helpful. If so, do me a favor and let me know in the comments or give this video a thumbs up. See you soon.